Hi viewers, this is Dr. Dhanasekhar again in SS Childcare channel. Our channel today is going to speak about one of the most commonest things of use, which is going to be paracetamol. Paracetamol, as you all know, is now become the drug of choice and is the most commonly used drug for the management of fever. So you can see the media speaking about a 650 crore business for paracetamol, which is once very simple medicine, but now after COVID, this has actually become the most sought after drug. And if you are interested, the cost of manufacturing one paracetamol tablet is only about 15 paise, which is practically non-existent now, and you can see that paracetamol is being used so rampantly. Now coming to pediatrics, the drugs which are right in front of me are all nothing but paracetamol, and you can see here these medicines are used for the management of fever. Not only fever, they can be used for joint pains, for toothache, for headaches, etc. Now this paracetamol, as and according to the Indian government, is very strictly regulated. If you look at all these bottles, the first one I am showing you is actually the paracetamol drops. This actually contains 1 ml of paracetamol contains 100 milligrams. Now the second bottle, if you look at it, this is basically a 120 milligrams. So 5 ml of paracetamol contains 120 milligrams and this 5 ml contains 250 milligrams. So wherever you are in India, whichever paracetamol you are buying, the dose is strictly regulated and you cannot compromise in the dose, and it has to be stringent and according to the law. So for easier calculation purposes, one has to understand, depending on the age of the child, the paracetamol given can actually vary, but all of these can actually vary interchangeably. So if you have a 3 kilo infant or a 4 kilo infant, the first dose of paracetamol will be 15 milligrams per kilogram. So that's basically the drops here, and you can see here this is what we would use. So there is a filler which comes with the bottle, and all you need to do is take the required amount. Say if you got a 3 kilo child, I already said you the dose of paracetamol is 15 milligrams per kilogram, and that is basically what you will need to use to give to control fever. So this dose in this bottle will contain 0.4 ml, which will be equal to about 45 milligrams. So that's one. Now if you have a child who is 8 kilos and above, what would you give? Well, the simple answer to your question is paracetamol 120. Now if you have a child who is 15 kilos and above, I would use paracetamol 250. Now the dose again would be the same, it's about 15 milligrams per kilogram. Now imagine if your child has got a very high temperature and if you have to go to the hospital, the doctor there would give you a medicine called a suppository. Now what is a suppository? Now this, according to a lot of parents, is a drug which gives the child, it's spoken a big deal because they always say it was given through the bum. Now this paracetamol, when you give through the mouth, has to go through a pathway where it gets absorbed and it has to go to the brain for temperature control. But if you were to give the suppository, so the suppository is something like this. So this is basically like a small bullet, as you can see here. Now what happens is, in this suppository, this is given straight into the child's buttocks. Now this does not cause any diarrhea. This is not an enema. When you give this medicine through the bum, it actually helps to reduce the temperature very quickly by bypassing all the mechanisms, and it works straight onto the brain. So that's basically a suppository. So if your child has got high temperature, that's what they would give. A simple tip or a simple take home message is, whenever you use a syrup, and if you open the medicine, imagine you opened this medicine already, please write the date of opening, and this medicine can be kept 1 month from the date of opening so that it is actually used. Now this is very important because when you use the dosage, I would recommend that you use a small syringe. So if you have a child who needs 5 ml of paracetamol, the simplest answer is take out 5 ml and there you are. It's very simple, it's spill proof, it's safe, and the child can just have the medicine directly into the mouth without spitting, coughing and spluttering. Now the problem is, if you give it in this cup, this is going to be more easy to spill and the dose can be quite variable. So 5 ml in the cup can be 4 ml or 6 ml, but whereas when you give it through a syringe, it will be exactly the same. So please don't forget to use this. It's a very small tip and a take home message, and that is what I would like to see. Here in our channel, we speak so much about different things, but all of them are scientific and evidence based. So I'm hoping that we will be able to meet again in another episode where we will be able to discuss a few other things which will be of very good importance and equal importance to your child. Keep watching, keep subscribing and keep commenting. SS Childcare always by your side. Thank you all very much and take care.